Hi, my name is Melissa. I'm a registered nurse. I've been a registered nurse for several years now. I started my career in the operating room, and I started at the Foothills Medical Center, and I'm still currently there, as well as at the South Health campus.
My name is Cynthia. I've been a registered nurse for 4 years. I started off my career in medical surgery, and now I do primarily plastic surgery in hospital and non-hospital facilities.
I really like the Kyra Comfort 500. It's a great stirrup. It's rated for patients up to 500 pounds, which is very important due to the high BMI of a lot of patients undergoing surgery these days. The stirrup itself has patented core grip technology that allows it to be lightweight, which is very important for healthcare workers, while not compromising on the maneuverability and the strength of the product itself. The straps are really nice. They are made of silicone, so they're easy to clean, which is super important in the hospital setting to avoid hospital-acquired infections. The nice thing about these Kyra Comfort 500 stirrups, as well as the foam in them, it allows for patient comfort and avoiding nerve injuries and pressure points during surgery, which is very important, particularly for larger sized leg for the higher BMI patients. The boot is able to be articulated very easily, so you can articulate it into any position depending on which procedure that you're going to use. Both the Kyra Comfort 500 and Yellofins Apex stirrups have a wide lithotomy range.
The Yellofins Apex has a lithotomy range of -32 degrees,
while the Kyra Comfort 500 has a lithotomy range of -55 degrees.
The Yellofins Apex has a +80 degree lithotomy range,
while the Kyra Comfort 500 has a +85 degree lithotomy range.
The Yellofins Apex has a abduction-adduction range of 23 degrees to -9 degrees.
While the Kyra Comfort 500 has an adduction-abduction range of 25 degrees to -9 degrees. So this is the new Yellofins Apex stirrup. It is rated for patients up to 500 pounds. It has silicone straps that open from the medial aspect of the stirrup out to the lateral. So when you attach the strap in, it attaches into the medial part of the surgical field. The unfortunate thing about this is that these straps hang into the surgeon's surgical field. So as a nurse, it's very difficult to adjust them while the procedure is taking place. It's also difficult that the ends of the straps hang into the surgical field. The other thing about the Yellofins Apex stirrup is that the boot articulation is a little bit difficult. It takes quite a lot of effort to articulate the patient's limb within the stirrup. You have to put quite a bit of effort in, which may be a problem for those healthcare workers who have a shoulder injury or who are otherwise not strong enough to articulate the arm. You can articulate the entire stirrup from the end by squeezing the lever at the end of the stirrup. So another aspect of the Yellofins Apex stirrups is that it has thinner padding when compared to the Kyra Comfort 500.
The padding here, you can still see the plastic, which the Kyra doesn't have.
This is important because you want to avoid potential patient injuries both to nerves and to pressure points during the procedure,
especially with our higher BMI patients.
So the Yellofins Apex stirrup is over 19 pounds each, while the Kyra 500 Comfort stirrups are 13.5 pounds each. That may not sound like a lot, but it makes a big difference for those of us working in the operating room.
Things are always moving fast, and we're always trying to clean new equipment and bring new equipment. And if it's super heavy, someone can accidentally hurt themselves by dropping it. Because of the busy environment and needing to switch out equipment for new patients, this can lead to higher injuries because we're trying to move around heavier equipment.
And also, when you're doing it several times a day, it can get very difficult to lift something as heavy as almost 20 pounds each.
It also matters when we're moving the patient while they're in the stirrups.
The lighter and easier to use the equipment is, the better it is for all of us in the operating room. Well, now that I've had the opportunity to work a bit with the Yellofins Apex stirrups and the Kyra Comfort 500 stirrups, I would have to say that I much prefer the Kyra Comfort 500 stirrups. They're lighter, they're easier to use, and they're easier to attach to the OR table.
It is a lighter product, which means that healthcare workers are less likely to injure themselves. I like that the 1-inch padding is provided, and it kind of covers the entire stirrup throughout to prevent nerve injuries or pressure sore injuries. The adjustability of the stirrup is quite easy to use and handle. The lithotomy range is greater, so there's more adjustability for the healthcare worker. The best part is that the silicone straps go from the medial to lateral aspect, meaning that it doesn't contaminate the field, the sterile field, during surgery. Also very easy to clean and easy to use.
Overall, I would have to say that the Kyra Comfort 500 is the superior product, and I would absolutely recommend it for use in all surgical facilities.
Although the Yellofins Apex is a good product, I would recommend the Kyra Comfort 500. Our general consensus is the Kyra Comfort 500 is the recommended product.
Thank you so much for having us today.